If eyes are the window to your soul, hair can be seen as a window to your health.
Introducing Anabel Kingsley, Brand President and Consultant Trichologist at the iconic British haircare brand Philip Kingsley. Anabel is not only the brand president of Philip Kingsley, she's also a practicing consultant trichologist herself. Anabel has an immense passion for helping those with hair and scalp concerns.
Generally, it is normal to lose up to 100 hairs a day. Your hair isn't like grass. What you do to the ends does not affect growth from the root.
What about the hairbrush we use?
That definitely matters.
Anabel can also be found busting the common hair myths on social media.
Stress in itself, the production of cortisol can impact the hair growth cycle.
Rosemary oil.
I mean, I'd reserve rosemary oil for your cooking.
Well, it just shows how easy it is to fall for myths you read online.
Your scalp is skin. When someone says that their hair used to be able to grow to here and now collar length, then there's something going on.
Hello everyone and welcome back to Vision of Health, the podcast where I talk to qualified experts about what being healthy really looks like in everyday life. I'm Dr. Frankie Jackson-Spence. I'm a medical doctor specialising in cancer research. My mission is to bridge the gap between science and real life, offering you practical advice to help you improve your lifestyle that is actually backed by the evidence. I'm Dr. Frankie and this is my Vision of Health. We've spoken before on this podcast about the gut microbiome and its impact on our wider health. But interestingly, our skin, including the skin on our scalp, also has its own unique microbiome. Introducing Anabel Kingsley, Brand President and Consultant Trichologist at the iconic British haircare brand Philip Kingsley. Anabel, thank you so much for coming on Vision of Health.
Oh, thank you so much for having me. I'm so excited to be here.
Me too. It's great to see you again. I know we did a few events and Instagram lives together and things in the pandemic, and I learned so much from you. So I'm really interested to chat to you today and kind of bring a more fun episode to Vision of Health. Often the topics we discuss are kind of quite heavy, and I obviously love hair.
Yeah, you have beautiful hair.
That's very kind. So I'm really excited to chat to you about this, and I think there's so many myths that go on social media, so we've got a lot of busting to do.
We do, yes. One of my favourite things to do.
Mine too. First things first, you're a consultant trichologist. Can you explain to our listeners what a trichologist is? What do you do?
So trichologists are scientists of the hair and scalp. So while we're not medical doctors, if you take kind of that away, it would be that, you would see a dermatologist for any issues with the skin on your face or your body, and you would come and see a trichologist if you have any issues with the skin on your scalp or the hair that's growing from your scalp. So we specifically focus on that particular area of your body.
And so who would need to see a trichologist?
I mean, anyone can come and see a trichologist, but if you have any concerns about your hair and scalp, it's a good idea to begin. So if you're having hair loss, so whether that's you're noticing thinning or you're seeing more hair coming out when you're showering, when you're brushing your hair, or if you have an irritated scalp, so if you're experiencing dandruff or you think you might have psoriasis or seborrheic dermatitis, even for cosmetic issues, if your hair is breaking off or it's not in the condition that you want it to be, and you don't know what to do, you can see a trichologist for those things as well.
That's great. So I'm going to get straight to the question everyone wants to know. It's the question on everyone's lips. How can we get our healthiest head of hair?
Oh my goodness, that's quite a long answer. We at Philip Kingsley, we take a very holistic approach to caring for your hair and scalp. It's not about just one thing, and it isn't only about the products you're using. Your hair is, so if eyes are the window to your soul, hair can be seen as a window to your health. It's such a reactive tissue because it is non-essential tissue. So your body gives it last priority. So if your general health isn't at its best, if you aren't eating well, if you're overly stressed, all these things reflect very quickly in your hair, and often much sooner than they would impact your your general health. So that's the first thing. To get your best head of hair is to optimize your general health. And I could go on for ages. Maybe later I can go into kind of all the things that you can do. And then the next thing is scalp health. So your scalp is your hair's support system. It houses your hair follicles. If your scalp isn't in good condition, your hair isn't just going to be growing at its best. So regular cleansing, treating any issues, flaking, itching with targeted topicals, and then also caring for the condition of your hair itself, and using the correct products, moisturizing your hair, using deep conditioning masks, and then doing things, making sure that you're not doing things that are causing undue harm to your hair. So minimizing the use of heated styling tools, using the correct hairbrush, detangling your hair in a way that isn't going to damage it. All of these things together are going to get you your best head of hair.
What I love about that answer is you mentioned about lifestyle and having, how important our general health is for our hair. And what I love about this is whenever we have a lifestyle behavior, say we do exercise to try and improve our heart health, it often benefits so many other parts of our body. And so they're all overlapping, which is just all the more reason to engage in these healthy habits. Are there any lifestyle behaviors in particular that will benefit our hair or kind of detriment our hair?
So the first thing would be stress. So as you will know, stress is terrible for our bodies generally, and it can really have bad repercussions on hair growth as well as scalp health.
I remember, sorry to interrupt you, I remember when I was a medical student, the long periods of revision, and my hair would fall out more so than normal.
And that's such a we see at our clinics a lot of young men and women who, they're brought in by their parents during exam time because of hair shedding, because stress in itself, the production of stress hormone cortisol can impact the hair growth cycle. But then there are other things that go on when we're stressed. We might not eat as well. We might skip meals, or maybe we're reaching for foods with little nutritional value. Potentially it impacts how your gut's able to absorb the nutrients that you are ingesting. It can flare up scalp conditions like dandruff, seborrheic dermatitis, and we know that any flaking of the scalp can increase daily hair shedding. So the first thing would be to try and take steps to manage your stress levels. And that's different for everyone, I think. Some people swear by yoga, other people hate it, but they prefer Pilates or brisk walks or swimming, whatever works for you to keep your stress levels at their kind of lowest level possible. I know it's really difficult in today's day and age to actually to completely eradicate stress, but unhealthy excess stress, it is really important to keep it under control.
Yeah, and it's often we don't acknowledge stress until you can see it. So someone might have an extreme and have like a heart attack, or someone might have like a burnout or a breakdown, or then the losing hair is being able to see your stress in your body. And I think we all need to practice all the things you just said. Even if we're not experiencing those extremes, it's like a great habit to ingrain anyway as a preventative thing.
Yes, exactly. Managing stress is a great way to prevent issues with your hair and scalp. Yeah. Next up would be just eating a really healthy, balanced and varied diet. As I mentioned before, hair isn't an essential tissue, so it's the last part of you that your body's going to send nutrients towards. It's the first part of you to be withheld from. And even small nutritional inadequacies that may not affect your general health can impact hair health. And also hair cells, they're the second fastest dividing cells the body makes. So their nutritional and energy requirements are really high. So you have that. Hair is a very needy but not needed tissue. So it's really difficult to kind of give it what it needs, but possible. Don't skip meals, especially breakfast. A lot of the, especially the women that I see, they don't eat breakfast. Either they say they're not a breakfast person, or they don't have time to have breakfast. But it is really important because you've been fasting for maybe, 10 hours, you wake up, every cell in your body is in need of fuel, and especially your hair cells, because they're not essential. So if you skip breakfast and then you have lunch, at that point, your body's just shuttling all those nutrients to keep your essential systems functioning, like your skin, like your nervous system, and then your hair really doesn't benefit at all for most of the day. Eating, not cutting out food groups if you don't have to. I know certain people have intolerances or allergies, but, don't cut out carbs. They're really important, and they give you a slow and sustained release of energy, which is really essential for hair cell production. Eat foods rich in iron and vitamin B12. Take a vitamin D supplement. It's probably the most common deficiency we see is a vitamin D deficiency. Yeah, and every hair follicle on your scalp contains a vitamin D receptor. So it's really important to healthy hair growth cycling. And it can actually worsen male pattern hair loss. So take a supplement, because you can't get it just through the foods that you're eating.
Absolutely. It comes from the sun. And apart from today, where it's surprisingly sunny in London, we don't get much of that, do we?
No. Do in New York, though. But then, sunburn and all of the...
Very true.
Yeah.
Are there any foods that you particularly recommend for healthy hair? The reason I ask this is because I recently got a dog and she has a really shiny coat, and I feed her oily fish thinking that will then make her coat more shiny. Is there any truth to that?
I mean, so oily fish, very nutritious, as long as it's not a high mercury fish like tuna fish. We try and steer clear of those as much as possible. But, packed full of protein, omega-3s, they're anti-inflammatory. It will definitely help, support hair growth because of the protein. Your hair is made of protein. In terms of making the hair glossier, what you eat is impacting the hair that's growing from your scalp. Yeah. But it has no effect at all on the hair that's already grown. So you noticing your dog's coat being more glossy,
I've fallen
it would have to be like, 5 months down the line that you would notice, because I don't actually know how fast a dog's hair grows, but human hair grows around half an inch a month. Yeah. So you'd have to factor that in. And it takes 3 months for a dietary change to show up positively or negatively in hair growth and condition. So it's about 5 or 6 months that you would see a change maybe to the condition of your hair through dietary changes.
Well, it just shows how easy it is to fall for myths you read online, because I fell for that one.
I mean, maybe, your dog's getting the oil on their mouth and then rubbing it
maybe
on their hair.
I might try a little bit of hair oil on her. I remember a few years ago when we first had a conversation, you told me to kind of split hair health into, you've already kind of mentioned this, growing the hair from the root and the follicle, and then looking after the strands you've got. So I'm going to split my questions into that to make it really easy for people depending on what their concern is. When we are trying to encourage hair growth, we all want to grow healthier, longer hair. I feel like it's conditioned in us from a young age. Are there any products that actually encourage hair growth, or is it just genetic?
From the root hair? There are products definitely that can encourage hair growth. So for female pattern and male pattern hair loss, there's minoxidil, which is really effective. You can take it orally as well. We use topical drops in our clinics. So that definitely works. For men, finasteride, either take topically or ingested, can also be beneficial. For women, it's quite tricky for women because it depends on what is causing your hair to thin and whether it's actually thinning or whether it's shedding, because those are two very different things. But for women with thinning or female pattern hair loss, and it's due to something like polycystic ovary syndrome, something like spironolactone might help. But then those are things you have to discuss with your doctor. In terms of hair shedding, there are some effective drops that help to regulate the hair growth cycle. But it's a tricky one because there's always a reason for hair shedding, and it's an internal reason. So you can have a self-limited bout of hair loss that lasts 3 months, and this is really common. So you were really stressed for exams and then it rectifies itself, or you had a high fever, you had COVID, and your hair sheds 3 months later, sheds for 3 to 4 months, and it stops on its own and really no treatment is needed. Then you have chronic cases of hair shedding, which is called telogen effluvium, where either the shedding goes on for longer than 3 to 4 months or it just keeps happening. So it 3 months your hair is coming out, 2 months, it stops for a month, and then it starts again, and that cycle repeats. And in those instances, there's something going on internally that needs to be found and addressed. So commonly, ferritin stored iron deficiency, vitamin D, vitamin B12 deficiency, hypo or hyperthyroid, hormonal imbalances. And so in those instances, you can use topical drops that help to minimize the hair shedding, but you also then have to treat the actual cause of the hair loss itself, if that makes sense. I would say that any brand that's saying, that isn't prescription and doesn't contain something like minoxidil, and they're saying that their product can regrow, female pattern hair loss, it just doesn't. Caffeine can be beneficial, but it's only leave on if you read the studies. Okay. So a shampoo with caffeine, you're washing it off. It's not going to do anything at all, but potentially drops that you leave on with caffeine can help. Yeah.
So I guess the important thing there is that people shouldn't necessarily just kind of take a recommendation from someone online because they claim a product kind of helps their hair growth. There's usually a specific treatment for a specific cause.
Everyone's really individual. Yeah. The causes of hair loss, they vary. And it's important to remember that some of the people on, TikTok who are recommending something, maybe they just had a short-term self-rectifying telogen effluvium hair shedding. So I've spoken about this before. You have, you've been losing hair for 2 months, you panic, you reach for a bottle of X, you put it on, and, in a month, your hair stops falling out, and the influencer puts it down to the product that they just bought, when in fact their hair shedding would have stopped at that point anyway.
I'm so glad you said that, because whenever it comes to these quick fixes, I always think what mindset are you in when you embark on that quick fix? Because it's probably not just that you're doing. Yeah. You're probably also using all your hair masks and avoiding heat and all the other things that are good for our hair as well. And so it's quite hard to pinpoint whether something's actually working.
Exactly, which is why actually it's good to just try one thing at a time. Because yes, then you don't know what's working. And also you could potentially just overwhelm your scalp.
So moving on to the scalp, I mentioned before in the introduction that the scalp has a unique microbiome of all these microbes that live in harmony on our skin and also in our gut. How much do we know about the science of the scalp microbiome? And do the products we use kind of cause an imbalance on that?
We actually don't know a huge amount yet about scalp microbiome. More research is being done at the moment. But I guess the hair and scalp are always last in these studies to be looked at. We know, so your scalp's naturally covered in yeast, so specifically Malassezia yeast. And we know that when there's an imbalance of these or an overgrowth, things like dandruff and seborrheic dermatitis can occur. So using products that help to kind of prevent an overgrowth, or actually you don't necessarily need specific products to prevent an overgrowth. It's just shampooing your hair regularly, or your scalp regularly.
You're a big advocate of scalp cleansing, aren't you?
I am, yes. It's not actually hair washing, it's scalp cleansing. You don't need to scrub your hair. You shouldn't scrub your hair. You focus on your scalp, which is skin. That's what needs cleansing. That's what produces oils, has, dead skin cells, sweat, pollution. Spend about 60 seconds gently but firmly massaging all over the scalp. And then you just squeeze the suds of the shampoo through the lengths of your hair, and then you rinse. Yeah. But yes, your scalp is skin. You take it to the same places as the skin on your face. You wash your face twice a day. I'm not suggesting you wash your scalp twice a day. It's not necessary. But I think a lot of the time, logic goes out of the window when it comes to scalp health, but because you can't really see your scalp. Yeah. And I guess we don't care as much about it because it isn't visible to other people. We really take good care of the skin on our face, and we put, lots of treatments, but because people aren't scrutinizing our scalp. But in the long run, it is really important for the growth of your hair and how it behaves, how it looks.
And when you mentioned there about how often to cleanse your scalp or wash your hair, how often should we be doing it? Because one of the myths that I hear and I don't agree with is that your hair cleans itself the longer you leave it. So if you've got greasy hair, if you increase the time between your shampoos, your hair can get used to it and become less greasy. Is that a myth?
It's a myth. So it's the worst myth ever. So one, your hair is, once it's grown, it's technically dead tissue. So your hair doesn't get used to anything and it can't clean itself. And no external skin is self-cleansing. If you stop washing your face for a week and you're putting makeup on it, because you do put makeup on your hair and scalp because you're, hair products, it's going to get greasy. It's going to get, pimples and, I guess your hair doesn't get used to not being cleansed, but you might get used to it. Like get used to how your scalp and your hair feels. I sometimes say, you have a white carpet and the first spill you have on it is very noticeable, but as you keep spilling, you don't notice it as much. And it's kind of the same with your scalp. The first few days of not washing, and this is what I hear a lot of people say, that their scalp gets very greasy and they can't stand it. And by week 2, it's cleared itself up, when at that point, it's just because they've gotten used to it. And what I can say is I can tell when I give someone a consultation and I'm examining their scalp if they've left them more than 2 days between shampooing, because one, you can see the flakes in the oil, but it also smells. I mean, oils are broken down and they start to produce a bad odor. So
I hope you never look at my scalp then. I'm really guilty of leaving my hair washes probably a bit too long, because I often feel like I'm guilty of using heat on my hair. So I think I'll delay my wash so that I put less heat on it. Is that the wrong attitude? Should I wash my hair more?
It's a balancing act, because shampooing is very good for your scalp, and it's not harmful to your hair. But if you're then heat styling every time you shampoo, then the good of shampooing will be outweighed by the damage that you are doing heat styling. Also, if you're not prone to scalp conditions and your scalp isn't naturally oily, leaving 2 to 3 days maximum is probably okay. Yeah. It's when you leave more than 3 days that it will be having definitely a negative impact. How many days to?
It depends on my gym schedule. I tend to time my hair washes around my workouts. I would say I probably do it every 4 days. So like once at the weekend, once midweek.
Do you find your scalp gets itchy?
No, I don't actually. I would say it only gets itchy if I use a dry shampoo, but it does get greasy. So there's probably something not that healthy going on up there. But maybe I'll wash it a little bit more. It's really time consuming, like fitting in a hair wash, especially if you use elasticizer and things. So really? And your hair looks amazing. Wow.
Well, so does yours.
Thank you. But maybe it could look better if I washed it a bit more often.
Yes.
Wow. So on the topic of trying to grow our healthiest head of hair, supplements, a huge market, complete minefield for people. Often they're very expensive and people don't really know which ones to take. Do we need supplements, and are there any that are actually beneficial for our hair?
So in the case where hair shedding, so telogen effluvium, is due to a nutritional deficiency, supplements can, completely treat the situation. Because hair isn't an essential tissue and hair cells divide so rapidly, it can be difficult to meet your hair's requirements simply through diet alone. So taking a supplement can give your hair some extra support. If you are experiencing extra hair shedding, taking an all-round nutritional supplement that contains the most common nutrients that we see deficiencies in, so things like iron, vitamin D, vitamin B12, that can be helpful if you're not unable to get a blood test done. But ideally, you should tailor your supplements to what your blood levels are. Because, some supplements, they'll contain all of those things, but maybe you only have a deficiency in one. And so you don't need to be taking the others. And potentially it could be harmful if you're kind of overdoing it. What I often see is people just grab 20 supplements, literally sometimes, and they're not checking what's in them. So they have a lot of crossover and they're, taking far too much vitamin B12, or they're taking, 50,000 units of biotin. And it can be harmful and not helpful. So I would say for anyone who's really serious about getting, their hair as healthy as it can be, is to have a comprehensive blood test and then choose your supplements based on that.
And who's biotin suitable for? Because biotin's a bit of a hair care buzzword, isn't it?
I mean, there's no harm in taking biotin. I mean, I say that, but actually there are two things. If some people find it breaks them out, not everyone, but there can be a correlation. The other thing is that it can skew the results of thyroid tests. So we commonly do blood testing at our clinics, and we will have to, if we want to send people in for a blood test that day and they're taking a biotin supplement, which is often the case, we'll have to get them back in. So wait a couple of days off the supplement. So those are just things to be aware of. A lot of people find that when they take biotin, their nails are growing stronger and that eventually their hair becomes stronger. Again, it takes, about 3 to 6 months to show up in your hair. But no one's biotin deficient.
Yeah. But I remember us having a conversation about this, and supplements are a grey area for me to discuss as a doctor because, like you said, unless you're deficient in something, there's rarely an opportunity where I can say, you need to take this. But I remember us chatting about how, say we have a normal range that's deemed normal in healthcare, and you normally sit at the high end of that range and you happen to be lower within the normal range, you are at lower than your normal levels, but the test is never going to pick up that you're deficient. And so actually in those instances, that's where supplements, I feel, may be helpful. But it's really difficult to explain that because if you did a blood test, you've got a normal level.
Well, what I'll say is, when you read blood tests, you have to look at the whole picture. It's not just about levels correlate with each other. But for hair, there's a different blood reference range. So anything generally towards low normal in the normal reference range is too low for your hair. So you really want to keep your levels from mid-range to not beyond the upper limit, but to the upper limit of the reference range. I am yet to see someone with vitamin D that's kind of too high, or, I see a lot of people with high B12 because they're popping those supplements very readily. And ferritin, stored iron. It's quite rare that I see that even within a healthy range. So, taking not a high dose, but if you're not getting blood tests, a low dose iron supplement, especially if you're a woman and you have heavy periods, I think is a good idea.
And especially now, I think as well, so many people are turning to more of a plant-based diet with the whole 30 plants a week research that came out. And so if you're suddenly reducing your red meat consumption and not getting iron appropriately from plant-based source of food, which you certainly can, but you need to have a knowledge of which foods contain it, then I agree. A supplement is unlikely to do any harm, but it's so important to pick a high-quality supplement and not just take all of them because you've seen people recommend different ones. Do you need to take supplements at the same time, or do you need to time them differently? Is there any supplements that...
With supplements, there are certain things that you shouldn't take together. So iron and calcium, the calcium is going to impact iron absorption. So, look up what your supplement, if you're taking an all-round multivitamin or if you have a lot of pills that you are taking at the same time, look up to make sure that they're actually compatible together, because certain things can impact the absorption of other things.
Yeah, really good advice. What about collagen?
What about it?
There's so many people that rave about collagen drinks for their skin and hair.
There's no evidence.
No.
absolutely no evidence.
Interestingly, some evidence for collagen that may be useful for women for kind of ligament, bone, joint strength, particularly for women as we age and estrogen drops. But there isn't any for hair and skin health. No. I just think it's so interesting that people are so quick to pay the price of collagen when actually there's nothing backing it.
I mean, I guess there's no harm in taking it, but again, it's very unlikely that it has any benefit at all, and it can be quite expensive. And also, if you have a hair loss condition and it's a progressive one, and you're kind of betting everything on drinking a collagen drink, you're losing time in treating your hair loss condition in an effective way. And for things like female pattern hair loss, I mean, it won't progress rapidly in 3 months, but let's say you're drinking collagen for a year and you're just waiting for the effects to kick in. Once something like female pattern hair loss has worsened, it is harder to treat. So you're really better off using something that has solid kind of clinical studies behind it. And if alongside that you want to drink collagen, then go ahead. But I would not use it as your only treatment for anything.
I think you've really highlighted an important point there when we turn to social media for health concerns, because if there is something more serious or treatable going on, you're actually delaying getting an effective diagnosis and treatment by following these trends that are often by unqualified people without any evidence. So I'm really glad you mentioned that. Talking of viral TikTok trends, let's go through some of those. I'm obviously someone who clearly believes them based on what I said earlier, but trends like scalp massage, do they work?
So scalp massage is, it's great for exfoliating the scalp. It can aid in product penetration, but it's not a standalone treatment for hair loss. And actually, if it's done incorrectly, so if, we've seen traction alopecia where someone is just rubbing, vigorously their front hairline and they're breaking their hairs, or they're using a scalp massage brush that's quite rough and they're damaging their scalp.
They're quite hard, those scalp massage brush.
Or they're tangling the hair, especially if you have long hair and they're breaking the hair. So, I love scalp massage. We do it in our clinic. It's very relaxing, but we use it as a way to exfoliate the scalp to help in product penetration and to relax the person in front of us who is almost always quite stressed because they have a hair or scalp concern. But it's not a standalone treatment for hair loss.
So in terms of the supporting blood flow and encouraging blood flow to the scalp to encourage hair growth, not that much in that?
I mean, not red, no.
Okay. And if you were going to do scalp massage, do it with your hands?
Yes, fingertips. They're free and they're your best tool.
I know, we just don't need a tool for everything, do we? We just like to throw money at situations sometimes. What about rosemary oil? Does scalp oiling really help for hair growth?
I mean, I'd reserve rosemary oil for your cooking and focaccia bread. But for your scalp, this is so. Yeah, rosemary oil. I hear about it almost every day. So the whole thing stems from one small study that was done in 2015 on 50 men. So bear in mind, most people using rosemary oil, at least that I'm aware of, are women. So this study, everything is based on, was only men and only 50 men. And it was comparing the effects of 2% topical minoxidil to just rosemary oil solution. And it's saying it's as effective. Well, one, the study's not really large enough or good enough to actually say that. And the second thing is 2% minoxidil on male pattern hair loss in men isn't going to do much anyway. So what the study's kind of saying is 2% minoxidil isn't doing very much and rosemary oil isn't doing very much either. Yeah. Potentially, if the study comes out in 10 years that it's actually doing something, I'm happy to retract what I'm saying, but currently there just is not the evidence at all. And again, it can waste time in treating your condition in an effective way.
That kind of takes me on nicely to second category of questions, which is how to keep your hair that you've got healthy. And I guess for people that are, engaging with things like rosemary oil, they're probably improving their hair care routine and care for their health in general. So the people who are using rosemary oil are probably, using hair masks and minimizing heat and brushing really gently and things like that.
Or taking a supplement. Yeah.
So maintaining hair health once it's grown, where to start with that? First of all, we touched on hair loss. How much hair loss is normal?
So everyone's normal is different. But generally, it is normal to lose up to 100 hairs a day, provided that they're growing back to the same thickness as they were before. And, some days you'll lose more and some days you'll lose less. I would say that it's quite obvious when you're losing too much hair. So telogen effluvium is the term for excessive daily hair fall. And with that, it's not uncommon to see up to 300 hairs being lost a day. So that's 3 times the normal amount. And, Jen, if you think suddenly that, oh my goodness, that's a lot more hair than I'm normally losing, then, you probably are. Although you have to factor in other things. If you haven't shampooed for 4 days and you normally shampoo every day or every other day, you're going to see more hair fall then. If you recently had your hair colored, potentially you're seeing breakage as opposed to actual loss from the follicle. It can vary seasonally as well. But if it's more than is normal for you, then it is likely too much.
And what's the difference between hair shedding and hair fall, did you say? What were the two?
So hair shedding and hair fall, they're the same. So that's just too many hairs are coming out.
So hair shedding and hair thinning.
Okay, so hair thinning. Your hair must be very hungry then. Do you want to snap?
I did have breakfast though.
Okay. Lunch?
I have not yet. After
I have a granola bar in my bag if you would like it. So hair thinning that's female pattern hair loss. So that is when hair follicles on your scalp gradually get smaller and they produce hairs that are slightly finer and shorter with each hair growth cycle. So initially it's not even that you have fewer hairs than you used to. It's just that those hairs are finer and they're taking up less space. Sometimes you'll notice a bit of increased hair shedding with this, but not always. So this is a condition where a woman or a man will come in and they'll say, I haven't noticed any extra hair loss, but one day I looked in the mirror and I just thought, oh my goodness, I have less hair. And that occurs because you have to lose a certain volume of hair for it to become noticeable to you. Hair shedding, the follicle hasn't changed. It's still the same size, but something's disrupted the growth cycle that causes too many hairs to move from the growth phase into the resting called the telogen phase at once.
Okay. So when people say, I'm one of those, I can't get my hair past this length, is that because my hair stops growing or is it because it gets to this length and there's some breakage in there?
It could be either because your hair is you have a good length of hair.
I'm not trying to get it longer. It just won't go longer anyway.
That could just be your natural growth cycle. So the anagen or the growth phase lasts on average 2 to 7 years. So maybe your anagen naturally, genetically is, 4 years or 5 years. I'm trying to gauge but that's just you. Yeah. It's when someone says that their hair used to be able to grow to here and now they're only able to get it to grow to, collar length, then there's something going on that's changed your hair growth cycle because, it's capable of growing longer. Commonly, it's breakage because it is hard to grow hair long because the ends are wet. They've been weathered. They've been put through heat styling sessions, summers in the sun, tangling, chemical processing, coloring. So your hair might just be breaking, or you're going to get your hair cut every 2 months and your stylist is just taking off the amount that has grown. And sometimes, it can be due to other things like a ferritin or stored iron deficiency, or at least a deficiency for your hair. So, and this very much impacts this area of hair here, where the hair will grow to there, fall out, grow to there and fall out. And that continues until you move your ferritin levels up.
Ah, interesting. on that, is regular trimming for your hair the key to hair growth? Because that's another myth, I think.
No. Your hair isn't like grass. What you do to the ends does not affect growth from the root. Yeah. But if your hair is breaking and very damaged at the ends, getting those chopped off can help your hair to grow longer. Because if you have loads of splits, and you leave them, they'll just keep splitting further up the hair shaft, causing more damage. But if you regularly get a little trim and keep your ends healthy, you'll be able to grow it longer, if that makes sense.
Okay. And talking about our hair strands, hair products, obviously, there's some amazing products in Philip Kingsley. I've used them exclusively since I was 18. So that is now coming up to 13 years. And I remember I saw them on a YouTube recommendation from someone I used to follow when I was in sixth form. I know you're slightly biased on this, but I know you'll give an honest answer. Does the kind of brand and quality of hair product matter?
The quality definitely matters. But I guess it would be, does the price matter maybe? There are so many hair products out there, and it's overwhelming. The quality of hair products you use does matter, and it's often is reflected in price, just because usually when the price point of a product is higher, a better quality ingredient is used, although not always. Yeah. I would say one hair product isn't going to work for everyone. Our hero product, Elasticizer, which I absolutely love, even that some people don't get on with it.
Crazy.
I know, I can't believe it either. But there's nothing will work for everyone. Yeah. So it's important to try different things and find what works for your hair. What works for your friend might not necessarily work for you. And it's about what makes you feel good. Yeah. So, if an inexpensive, drugstore shampoo, you absolutely love it and it makes your hair feel amazing. And if you find that, a premium brand makes your hair feel at its best, definitely get that. I will say that, more premium brands, the formulas are generally better because you can get they use better quality ingredients.
I found before I used to use Philip Kingsley, is buying one from like the supermarket, and it would start making my hair really shiny, and then eventually it would start to go like almost feel really dry, and it's like it had a coating or something on it.
Yeah. I was actually going to mention that because I try out a lot of other hair products because I like to know what else is out there. I've judged hair product awards before, and some of them I have used initially, and I thought, oh, this is actually quite good. And then I keep using it for a week, and by the end of the week, my hair is in a state. So I think it's really important to, when you buy a new shampoo, you love how it makes your hair feel, use it for a week and then see, because sometimes it just gives good initial results and then, it's coating your hair, it's drying it out.
And so the products, that they do matter. What about the hairbrush we use?
That definitely matters. Yes.
Tell me more about that.
So the hair, I've had many clients whose hair breakage is either simply due to the hairbrush they're using, or it's definitely a factor in there. So a hairbrush is such an important tool because it's something that we use on our hair every day, sometimes multiple times a day. And it has the potential to cause accumulative damage, huge accumulative damage. It's very hard to tell when a brush is damaging your hair because your hair doesn't have nerve endings. You can tell if a loofah is damaging your skin because it will, your skin's going to turn red. It's going to be scratchy. So what I tell people to do is to test their brush on the back of their hand. And if it feels scratchy, if it leaves marks, it's going to be doing that to your outer hair cuticle, its protective layer. And over time, you're really degrading the outside of your hair, and it can cause substantial hair breakage and lead to tangling, dullness of color, if the cuticle's being sloughed away. So look for, well, always do the back of hand test. Boar bristle brushes are just kind of universally bad for your hair, but they also give stellar traction and shine to styles.
Like that's why when you go to a blow dry, your hair always looks better.
Yeah, and that's fine. When you go to a salon, let them use a boar bristle brush so that you get that high definition shine. If you have an event, or an important dinner, it's your birthday, get out your boar bristle brush and use it if that's going to give you the best results. But as an everyday hairbrush, or if you're just going to work that morning, use a paddle brush with the rounded plastic prongs and a vented cushion base.
Mm-hmm. I use the Philip Kingsley one, obviously.
Excellent. Yeah, I love that brush. But for high traction, for very smooth styles, you do need a brush with more traction.
And should you brush your hair when it's wet? Because I'm guilty. I don't know if it's a bad thing, but I would comb my hair through when it's wet with conditioner on.
I do that as well. Hair is more vulnerable to damage when it's wet because it's already stretched. So it requires less force to snap it. It's fine to brush your hair when it's wet as long as you're not overdoing it and you're using something like a conditioner that's adding slip or a detangling spray. So in the shower, I'll apply my conditioner, do my first detangle with my hands to get rid of any of the larger knots. And then I'll take a wide tooth comb and from the ends up, very gradually and gently comb my conditioner through up to about here. And that's helping to smooth the cuticle. It's making sure the conditioner is coating every strand. And then you've diminished tangles at that point and your hair feels much silkier. It's better to get out of the shower with no tangles and detangle while you're using that really thick conditioner that's helping to protect your hair a bit than to get out of the shower with a messy mat of knots and then stand there, tugging through them.
Good to know. Obviously, no heat styling is better than heat styling, but is there a safe amount of heat styling? Like how much can we get away with?
Again, a test on the back of your hand. So when I was flying yesterday, my tracksuit bottoms that I was going to fly in were still wet from the washing machine. So I got out my hairdryer to dry them and I put it on the highest heat and the highest speed setting. And I blasted it on my hand and it was scorching hot. And then also I could smell burning coming from the trousers. The same applies to your hair. If you use the highest heat and the highest setting, that is 100% going to be damaging. If you do a medium to low, just blast it against the back of your hand at the distance, because sometimes it isn't always about the heat, it's about the distance, because even a medium heat setting, if you're holding it right next to your hair, is going to be too high. Hold it about this far away from your hair, and then stop when your hair is just dry and use a hair-friendly hairbrush. And in those cases, it's minimal damage will be caused by heat.
I tend to, a bit like with the boar brush, I reserve my hair tong for special occasions like a wedding or an event or something, but try and get out of the habit of using that sort of thing all the time. But occasionally is okay.
Occasionally is fine. I mean, your hair is there to have fun with, and when your hair looks good, you feel good. But if you take care of your hair's condition and you heat style less, it's just going to start looking better without all that heat styling anyway.
I completely agree with that. I actually have naturally quite wavy hair, and historically I could never have just left it to air dry because it would look really frizzy. And then when I stopped using heat, I could then get away with embracing my own curls. It's just difficult, the transition period, isn't it? Moving on to kind of less cosmetic things, what are some of the most common medical conditions you see that affect hair?
So I would say the most common would be hypothyroid, or so underactive thyroid or overactive thyroid, but we do tend to see underactive more often. And that results in, severe diffuse hair shedding, so hair shedding from all over the scalp. And hair loss is actually one of the first signs of a thyroid condition.
And you lose the outer third of your eyebrow.
Yes, yeah.
I remember that from medical textbooks.
So it can have a big impact on the hair. PCOS, it's another one, really commonly can worsen female pattern hair loss. It can also cause extra hair fall and anemia. I would say are the three most common things, health conditions that impact the hair. I mean, I have ulcerative colitis. I wouldn't say that that's something I see as commonly in person. I have seen a few people with ulcerative colitis who have hair loss. But definitely whenever I post about it on social media, I get a lot of comments from people with that disease or with Crohn's disease who say that their hair has really suffered as a result of it.
Well, I suppose it relates back to the nutrition thing and the absorbing all of those nutrients.
Yeah.
One area that you're interested in is postpartum hair loss. And I think when we first met, you had just had your son. And
I was pregnant.
You were pregnant.
Yes.
But you suffered with some postpartum hair loss as well.
Yeah, terrible.
Tell me about postpartum hair loss, because I can imagine that's a really stressful thing for women to go through.
Yes. I'm really passionate about talking about postpartum hair loss because there's so much misinformation, or there isn't enough information about it. As with many things with women's health, there is not enough information. So when simplified, when we are pregnant, our estrogen and our progesterone levels rise. Estrogen and also progesterone, they're hair friendly, and especially estrogen helps to keep hair in the growth phase. So especially during your third trimester of pregnancy, much less hair is coming out. So you maintain many more hairs in the growth phase during pregnancy, which is why a lot of women find that their hair is thicker. When you give birth, those estrogen levels, they just plummet like off a cliff. And 3 months later, all those extra hairs that were maintained in the growth phase then shed. And that's kind of where the conversation on postpartum hair loss stops. It's just your hormones. It'll, you'll be fine. It'll grow back. But actually, more often than not, it isn't just the hormones. It's a lot of other things. It's when we are pregnant, you're looked after very well. You get given blood tests all the time. Your general health is closely monitored. And I feel like after a woman gives birth, forgotten about. But there are so many things that can continue postpartum that can impact general health, but your hair specifically, they're never looked into. So throughout pregnancy, things like iron deficiency and ferritin, stored iron deficiency are really common. In the third trimester and breastfeeding, vitamin D and vitamin B12 levels can be really taxed. When you give birth, whether it's a vaginal birth or a cesarean section, you're going to lose blood. And this can further bring, your iron levels down. And it's not addressed. Also, thyroid issues are quite common in the last trimester of pregnancy. They can also happen postpartum, but these things aren't generally followed up on. So you can be walking around for, over a year with all of these underlying factors impacting your hair, and you're told by your doctor or whoever you've seen that, just wait it out. It's just, your hair, your hormones, kind of, etc. When in actual fact, there's a lot more going on than that.
Yeah, that's really interesting. And I would really recommend anyone that wants to learn more about that. You post about that a lot on your articles and on social media as well. So you can definitely read or watch more on that. I'm really conscious of time, so I'm going to get on to my last couple of questions. You're clearly very busy. You're brand president of a global brand. You are practicing as a trichologist. You're a mum. How do you keep yourself healthy? Managing stress or whatever you do, what sort of some of the things you like to do to look after your own health?
It is challenging with work and 2 young children. I have 2 boys, a 1.5-year-old and a 3.5-year-old, and it is challenging to find a work-life balance and just a balance where you're managing stress levels. But my husband is very supportive. He's very hands-on. So I do, in the evenings, I will I'll make time to read a book. So to take time out mentally, I think is really important. I will, when I'm at work, I'll take about, half an hour a day out of my schedule to go walking around so that I can just clear my head, don't look at my phone. I might listen to a podcast or something, but just time where I am, I guess, focusing on myself or listening to something that I find interesting.
Yeah, I think that's really important. I think when you are successful and in the media and in the public eye, it's really easy to think it just comes easy to everyone, when actually it's really good for people to hear that, when you have a high pressure job and living situation sometimes as well, that you have like methods of managing your own stress.
Yeah, and sometimes, I do get overwhelmed. It's I don't, and I'm not, it's not always zen. And yeah.
Yeah. The behind the scenes reality
yeah,
is
exactly.
Often not what it always seems. Thank you so much for chatting. I have one last question that I ask everyone on this podcast. What is your vision of health? What does health look like to you?
I think that one of the most important things that we can do is to arm ourselves with really good information so that we can advocate for ourselves, for our own health. So being mindful of social media and only listening to advice from trusted professionals. But when you find someone who, who knows what they're talking about, who you do trust, really listen to them. My hashtag on Instagram is knowledge is empowering.
I mean, I completely agree with you. That's what this whole podcast is about. I think knowledge is power when it comes to your health, and being able to be involved in decisions you're making about your health and making informed choices is really crucial. So thank you so much for sharing all of your knowledge and your wisdom in this specialty with all of our listeners. I've learned so much from you over the years, and I really think everyone listening will learn so much from you as well. So thank you so much for your time.
It's been my absolute pleasure. Thank you for having me.
Thank you.
Thank you so much for listening to Vision of Health. I hope you've taken away some practical and realistic health advice that you can implement to improve your lifestyle and get clear on your vision of health. If you've enjoyed this episode, then please do let me know by liking the episode and leaving me a review. If you want to hear more from me, then make sure you're subscribed to the channel. And if you have any friends that could benefit from improving their lifestyle, then make sure you share the episode with them. I'll see you next time.